A defibrillator is a medical device that's used to treat the life-threatening condition of sudden cardiac arrest. It works by delivering a controlled electric shock to the heart, which can help to restore a normal heart rhythm. The history of defibrillators dates back to the early 1900s, when doctors first began experimenting with the use of electric shocks to treat heart disorders. In the decades that followed, various scientists and doctors continued to work on improving the technology and making it more effective. One of the most significant advancements in the history of defibrillators came in the 1950s, when a doctor named Paul Zoll first developed a portable defibrillator. This device was small enough to be carried by a doctor or paramedic, which made it possible to treat patients in the field rather than waiting to be transported to a hospital. Another major development in the history of defibrillators came in the 1980s, when medical bodies worldwide began recommending the use of Automatic External Defibrillators, or AEDs, in public places. These devices are smaller and easier to use than traditional defibrillators, which makes them well suited for use by non-medical professionals. Since their introduction, AEDs have become an important tool for saving lives. They can be found in many public places such as airports, schools and fitness centres. In many cases, the use of an AED can make the difference between life and death for someone who is experiencing a sudden cardiac arrest. Today, defibrillators and AEDs continue to improve and evolve. New technologies and innovations are making these devices more effective and easier to use than ever before. As a result, more and more lives are being saved every day thanks to these life-saving devices, and they're an essential tool for saving lives, and many found in public places throughout the world.